adoption of the agenda.
Make a motion to approve the agenda as presented.
And on to the next one, we have a scheduled delegation.
We should vote on that first.
Thank you. All those in favor? There we go. Very good. And now we have special guests, Dr. Robert Laughlin and Dr. Pam Edwards. If you'd like to come up to sit up front here and just state your name and place of residence.
No.
State your name, that'd be fine.
What's with that? Oh, we just want to come visit you tonight, that's all.
Yeah, we're gonna go for beer after.
I've lived in Prairie for 30 years.
And I'm Robin Laughlin. Currently I live in Jussar, but I work in Prairie. And I've worked here for over 40 years.
The floor is yours.
Hmm?
The floor is yours.
Okay, I'll try to be brief, but I'll give you a bit of history. Our hospital, new hospital, was first planned 12 years ago. And it's been, well, with 3 sets of plans because it's been cancelled twice. It's now finally going ahead. Always in the planning stages, in all 3 sets of plans, there was clinics, which the government accepted, and it was presumed that these clinics would be occupied by us and by any other medical clinics in town. During the 30 years that we've been in the hospital, there have been 4 medical clinics, a dental clinic and a pharmacy. About a year ago, the Alberta Health stated there'd be no room for doctors in this facility because Alberta Health had made some sort of edict that they would not be renting space. But 5 ministers of health had gone along with it, 5 premiers had gone along with it. Well, not 5 premiers, 3 premiers had gone along with it. Now Alberta Health is going to open a so-called health and wellness clinic, which they will staff, so that these people are, the doctors that are going to work in this clinic are not regarded as private physicians. Although they bill the same way we do, they bill Alberta Health directly for their services. So there's really no difference between them and us. Dr. Worry, who's the zone director for the North, has asked the government for between $2 and $5 million to set up this clinic and recruit doctors. And he's going to charge them 10 to 15% overhead expenses. 10 to 15% does not run any business. Or at least I would like to be in the business that does. So our expenses are around 30%, so that we're at a distinct disadvantage. We're at an even bigger disadvantage if we can't occupy space in the hospital. The whole concept of one-stop shopping started here 30 years ago. And we had pharmacy, dental, doctors, everything. It was good. Patients had access to physio, lab and x-ray directly. The new health and wellness clinic is going to recruit physios, dietitians and all kinds of other people. Now they're either going to get them by stealing them from the hospital, or they're going to duplicate the service that's already been provided in the hospital. And we've been fortunate in that respect that we have a good service from the parallel health professionals in the hospital. So this is a very, very unfair, and we believe it's become a personal attack on Dr. Edwards and myself. We've lobbied the Minister of Health, who wrote me a sort of non-letter. We've talked to the official opposition, and I guess our next move is to make this a public venture or a public issue.
Well, I do. Dr. Worry set up this clinic. It is actually a family care clinic. He's just naming it something different. he says he had to come in because we were a community in crisis. We couldn't get doctors here. Dr. Worry is actually refusing to allow Dr. Shepard to come back here, who wants to work here. He's refusing to allow him to work here, but he's been invited to go work in Wabasca. Dr. El-Masteri was also invited to go to Wabasca. So we're not actually a community in crisis. If he's actually encouraging doctors to move out of this community to elsewhere.
One more thing, this community health and wellness clinic, I think by offering doctors unbalanced expenses, you can probably attract people to come to High Prairie. But that's not what keeps people in High Prairie. They have to want to stay in this community. So the people they attract, they will ultimately lose. And the whole thing is going to implode one day.
To recruit physicians to our clinic, we actually have to use the recruiter from Alberta Health Services, who really, is unlikely to recruit for us because she is recruiting for the other clinic.
Is that what you think's happening right now with Shepard and Mystery, that they're not allowing them to come back here to keep the numbers down and to make it look like?
Yes. There have been a lot of doctors that have left this community over the years, there's no doubt about that. But I think that's the case in most small communities. It's getting harder and harder to attract doctors. So we should hang on to what we have. But the recruiter has certainly not done anything for us.
Who's the family GP for our area?
What?
The family physician. Is there a rep with Alberta Health Services for our area?
There's a community liaison physician. It used to be me, but I get fired recently.
And then who was after you?
Oh, well, they appointed someone from Wabasca who gave up after a month, and they now have someone from Edmonton.
Representing our community.
Well, acting as the sort of reference point and the disciplinarian and the person who ensures that the hospital bylaws are complied with. And that's proven to be useless. We're supposed to have a medical staff meeting every month.
Every month, yes.
We haven't did one for 5 months.
Since the summer. Which was one of the reasons why you were fired.
Yeah.
Because he wasn't having the meetings, or because he was and
Well, this is just a little aside, but as well as having a chief of staff in our hospital, and a president of medical staff, and the president of medical staff called the meetings, and we agreed that we didn't need them every month, we'd do them every 3 months, and that suited everyone. But yes, this was part of the excuse.
this physician in Edmonton, does he come out every month to visit the communities?
Never seen him. Oh, we saw him once.
Mm-hmm.
He came about, what, 3-4 months ago.
So
I mean, he knows nothing about High Prairie.
Wow, yeah.
So you guys have met with Dr. Worry and tried to work with him? Like, isn't he sort of your zone? Like, he's your zone rep, is he not? Like,
No, he's not our rep. He's the government's appointee. He's in charge of the northern zone. We did talk to Dr. Worry, but I've talked to him many times over the years. And I may add that 2 years ago, I was at a meeting in Edmonton with the then Minister of Health, and Worry came in and backed us over the issue of having the clinics included. The government were proposing to do away with clinics completely. Dr. Worry came in and said we would not give in and giving up the medical clinics, that we'd just dig in our heels and insist on being medical clinics for all the doctors in the community.
I heard.
I'm sorry, I missed what that was. You were saying Dr. Worry backed them, or said said
He
no.
backed us 2 years ago at a meeting with the Minister of
Oh,
Health.
okay, he supported you then and said, no.
He
we need
supported us
clinics.
then, and he
Okay.
said to the meeting, there was a lot of people
Yeah,
there.
yeah,
He said, we will not agree to this hospital without the medical clinics.
okay.
And at that time, everyone assumed that our clinic and the other clinic would be part of it. The crisis was provoked when Dr. Dutoit left and there was no one to go into the other clinic.
Is there a problem with the emergency department?
Well, we're very short of doctors taking call.
So
We've
how
only
many-
got 2 doctors taking call right now, so they're doing 2 days on and 2 days off. And that's unsustainable. We get locums in the weekends because of my age,
Yeah.
but I mean 2 doctors cannot. We need 5 or 6 doctors on call.
In your opinion, what is the optimum number of doctors that should be in High Prairie?
Anything from a minimum of 6 to up to 10. We've had 10 in the past and it functioned well then.
So, from what you're saying, this new hospital, this new health and wellness clinic will be in there, but they won't allow your clinic in there, that's what I'm understanding?
Yes.
Yes.
And their reasoning for that?
Is this edict that Alberta Health made 10 years ago that there would be no rental space?
For private business. And we're considered private business.
I mean, the dentist has a letter from Alberta Health promising him premises, and they just laughed at him. The pharmacist was told he would have space in the new building, and he's not going into the new building.
So nobody other than that Dr. Dutoit's clinic is going to be allowed
That's
in the
right.
hospital, is that what you're saying?
And as Dr. Edwards says, it will end up functioning as a family care clinic, which the government is now totally against. And if we see what happens in Slave Lake, it's hardly surprising. It was a massive financial catastrophe too, and it has not produced very good results. They've lost 4 doctors.
So what do you guys see as the solution? Is there a way for it, how big is the space? I haven't even seen a plan for the space. Like, is there a way for them to do both of, like,
Yes.
to offer the space
Yeah.
for you guys as well as this family?
The plan that it stands just now has got massive conference rooms in the clinic. We don't need massive conference rooms, we need clinic rooms. So there's definitely more than enough space to house 2 clinics, plus the dentist and the pharmacist if they're so inclined.
And you've spoken to the Minister of Health about?
The current one I've written to, I haven't spoken to him yet, I've been trying to get a meeting with him. It took him a month to reply to the letters that we wrote, and he was very non-committal.
Did you meet with Pearl?
Yes, more than once. And she was meeting the minister last week. Initially she, I think, had been in favour of the proposed health and wellness clinic. And after, I think she's had a change of heart, so she was going to talk to the minister last week too. We're supposed to be having a meeting with him sometime in January, but the longer it waits, the longer it will get cast in stone. If every community that's short of doctors goes to the government and says, look, I want between $2 and $5 million to set up a cheap clinic, we're not going to have money to spend anywhere on healthcare. And Valley View, they've shut their clinic because they don't have enough doctors. They could easily go and say, well, subsidise us. We're not asking for a subsidy. We've paid rent for 30 odd years. We could have bought the place by now and what we paid in rent. I don't think the doctors are entitled to a subsidy, but I think we're entitled to a level playing field.
So if you guys go in with your primary care network and with the community health and wellness center, with their version of their Aboriginal liaison, dietitians, physio, OT, and everybody else, and you're going to have your side also, or is it going to be a shared access,
I
cause.
don't know that.
Cause it really, I agree with you, what they're gonna
We
do
already
is
have these services in
I
the
know,
hospital,
they're
so
just-
why do we need to duplicate?
they're moving them from the public to this,
Yeah,
this
yeah.
clinic session
Yeah.
instead.
Exactly.
They're already there.
Yeah.
They've been there, except for they've been taken away for years too. But we've had access to those
It
previously.
would be
and
good
still do.
service from the hospital. Why fix it if it's not broken?
Cause they wanna move to an FCC or a CHWC,
Basically.
that's all
But,
it
but
comes
this
down
is
to.
contrary
I'll
to the
put it out
government's
there.
wishes.
Yeah.
The Premier and the Minister of Health have both said there'll be no more FCCs.
So Dr. Laughlin, and this is a question that the whole community has asked for the last probably 5 years. Why do doctors come here and then they leave?
Well,
And you must do exit interviews. Do you
What?
ask them, each individual, and why are you leaving?
most of the doctors that left our clinic left for social reasons. They, well, you know, they couldn't meet a wife, they wanted, you know, they wanted big cities, or else they come with a wife who doesn't like small town living. That's the commonest reason for people leaving our clinic. I hate to say this, but the majority of people that left Dr. Dutard's clinic left because of a personality conflict. And they've all said so, they're willing to come back and help out. Or some of them are. But small towns don't appeal to a lot of professional people, and especially their wives.
So in a way, the recruitment isn't matching. The doctors that come here, but they tour the town, they know what they're getting into.
They all seem quite happy when they come.
Yeah, and then within 6 months or a year, they're gone.
Well, we've had several good doctors who would have stayed here had their social circumstances been okay. They didn't leave because they didn't like working in High Prairie.
Well, it's financially lucrative to work in the northern Alberta areas.
It certainly is, but we've had, I mean, doctor who went to Calgary to work in a walk-in clinic because his wife wanted to move to Calgary. He makes a fraction of what he made here. We've had one doctor who went to Toronto for the same reasons.
When we were presented this model by Dr. Worry when we were in Edmonton, part of the concern was that doctors are getting burnt out because of the ER expectation. Or do you find that
Demand
that's
in ER is high. A lot of people go to the ER who shouldn't be there. There was a triage system set up years ago, and it's never been adhered to. But the nurse should be able to triage patients and say, you do not need to be in emergency. You can make an appointment in the clinic. I mean, if somebody comes to the ER with an emergency, they need to be dealt with. If they come with a semi-emergency, they need to be dealt with soon. But if they come for a renewal or pills or to get their ears syringed, they're wasting the time in the ER. I don't take call anymore, but one of the most frustrating things when I took call was having to deal with the fact that 50 to 60% of the people we saw were a waste of time. Not a waste of time in terms of the fact of the problem, but the problem was not an emergency. And in fact, if the problem is not an emergency, it's much better dealt with in a clinic situation where there's some more privacy.
Earlier you had said Dr. Worry denied Dr. Shepardshad from transferring to High Prairie, instead has offered up Wabasca. Was there reasoning behind that, or was that just just a
Dr.
statement made?
Shepardshad had some health problems, which have been dealt with. We were happy to have him back. He was keen to be back. He got to work here 3 days, and then the word came out he wasn't to work in High Prairie.
And that's it, just no explanation, just a statement?
Well, we can infer various, but no, no explanation.
How many physicians at your clinic currently?
There's 2 of us plus Dr. El Misteri, who's currently in Libya. Or is it Syria?
No, it's Libya.
Libya.
So you have an intern,
Mm-hmm.
he's from Calgary, and is he an intern here that is going to stay, or is he
Oh,
just?
we'll just keep failing him until he does.
Just keep it.
It's a good plan.
Thanks, Robin.
It works.
So, let's ask, what do you think about the social atmosphere of High Prairie? Is it a tough place to live, to
Well,
work?
to be perfectly honest, I grew up in a town that was smaller than this, of 1,100 people. And this is the size of a town I'm used to. Now, what is a barrier to a lot of people coming north is the sheer distance from a major center. Right now, what Dr. Laughlin and Dr. Edwards are doing by actually having residents and interns come to High Prairie is probably one of the best recruitment tools you could have. Right now, I'm going to be finishing my medical degree in probably the next 4 months, hopefully, depending on Robin. But regardless of where I end up practicing in the long term, because I have a significant other who's also a physician, I will be coming back to High Prairie to do locums, at the very least, if they'll have me. So I can tell you, it's actually quite a profound effect to get me to want to stay here and practice at some level. But I can totally agree and understand where Dr. Laughlin's coming from. It's hard when you're this far away from family, and it's also the biggest issue is probably the spouse. Most small communities, when they talk to medical students, their goal is to marry them in, because that way you know you've got them. But when you're coming here with a spouse already, it's not just keeping a doctor happy, because the medicine here is fantastic. And I don't even get paid doing this, just the opportunities here to practice are infinitely better than the city. But it's keeping 2 people happy, not just the one, and that's the trick.
All our residents and interns, and we have them all year, both from the U of A and the U of C, maybe not all, 90% of them regard this as a very positive experience. And we have recruited people who've been here as students and residents.
What is it that you'd like us to?
I'd like your backing when we tackle the minister. As I say, what we need is a level playing field. We need to have equal access to the facilities in the new hospital. We need a clinic in the new hospital. We need to have equal access to recruitment. And I still think it's dreadfully unfair to subsidise one clinic against another in the same community.
So, I can see what you're saying, okay, I want equal access in that. And I'm looking at the big building and I'm thinking, well, all right, then put 2 clinics in there. But one clinic is running a different model than your clinic. Your clinic is strictly business. It's a small business, it is.
Well, theirs is a small business.
They're getting paid
No,
a
they're doing the
different
same as us.
scale,
They're
fee for
billing.
service.
Sorry.
No.
Are you sure they're getting paid the same?
They're
fee for
billing
service?
Alberta Health the same we do.
But, and I understood, I could be wrong, and I'll be asking Dr. Worry this. After a certain number of patients, their fee goes down. So, example, I'm not sure if it's what the cutoff is, but if they see 30 patients, they get the same fee as you. If they see another 10 patients, they only get 50% of that fee. If they see another 10 patients after that, they only get 25% of the fee. So their fees are going down the more patients they see. That's what I understand that model.
Well, he's never told us that. It may be his plan to do it that way. That was never explained to us.
Okay, so we'll
But
be asking
it's
him.
not something that Alberta Health will participate in. If we see a patient, or we see 40 patients or 50 patients, the billing fee is the same.
Exactly,
how
exactly, for
could
that
they-
model that
yeah.
you're on.
Well, for all the doctors in the province.
But this model that they want to bring in is paying differently.
Well, if
Well,
that's,
then I would not see more than 30 if I was a doctor there.
Well,
So
that's what
that's-
they're trying to discourage, is to not see more than
Yeah,
30
that's right.
patients.
but
Is-
So, where are those patients going to go?
go to the
They're
ER.
going to OPD, where they're getting burned out,
Yeah.
and where they get paid triple.
See, my understanding of this is the province owns the clinic. It's not owned, it's not a private clinic, it's not, but I think we have to really understand both systems, because you're making it sound to me like it's actually the new doctors that they will recruit for this it'll be their clinic. They'll be paying rent in the form of a percentage.
Yeah.
My understanding was a province-owned facility. They didn't want any for-profit businesses.
But successive ministers of health over the past 12 years have endorsed this principle. And as I say, Dr. Worry backed us 2 years ago against the Minister of Health.
And the doctors are going to be making more money there than we are, because they pay less. I don't get this, we're a for-profit clinic.
They're
They're for a
for-profit
more-profit
position
clinic.
that's
right?
going to make more money per patient.
That's right.
Because they're
they
only
don't
being,
have the overhead.
That's-
Yes.
if they sign on with a private clinic, they pay 30% overhead. If they sign on with this clinic, they'll pay between 10 and 15% overhead, which is then subsidized by the taxpayers.
That's right.
Yeah,
If-
they never
if
really.
Provincial,
they see-
not municipal.
If their
Oh.
patient load is capped.
Well, even if it's capped at 30, let's say they each see 30. The 30 they see will have a 30% overhead on each one of them.
Yes.
These ones will have between 10 and 15% overhead. So I'm still gonna take more money home as a doctor.
As a doctor for the first 30. So, but what if the 30 is, let's say I wanna see another 10. I wanna increase my,
But why would you?
but I see what you're saying
Yeah.
about the 30%. The first amount, the private business is losing out.
There's no medical pay system in the world that doesn't function on the sort of semi-salaried basis. Because I worked in the National Health Service.
Yes.
We were encouraged not to see patients because we get paid anyway.
Mm-hmm.
And it's a very inefficient system.
Mm-hmm.
And that's what this is going to be.
And is the National Health Service still running the same way?
Well, they've tweaked it a bit, but it's still basically right. The doctors are paid what's called capitation. They're paid so much per patient per year.
Yes. So however many they have in their patient load, they're paid for those
Yes,
patients.
but if you don't have to see them, you still get paid.
Yeah,
So
you
it's,
still see them.
it's
Or
better.
you still get paid because they're in your,
Yeah.
you're in your database. Okay. All right. Well, you've given me some questions to ask Dr. Worry. I will go back to the recruitment though, and because I was concerned, and you know I sat in on that meeting and said that any doctors that come into this town have to go to your clinic. They cannot just go to the one clinic or be told about the one model.
Well, most of them didn't know there was 2 clinics.
Exactly, but now, as far as I'm understanding, every doctor that has been 2 or 3 here has gone to your clinic.
I've seen one. You saw one.
There's not been very many that come after that.
There you are, but
So could
the
you
ones that
back-
have gone.
I think one.
Okay.
Could you back up and explain for everybody here that doesn't understand what you're referring to?
The Community Health Foundation, that is a foundation that works with the health, has a physician recruitment committee as a subcommittee of that. And at one point it was George Key and Ken Matthews that toured doctors that came to this town. And you've probably seen them around, showing them the facilities. One of the concerns that was brought forward was when they were touring, they weren't looking at the High Prairie Medical Clinic. They were kind of being shuffled along and not seeing this clinic. So I was called in to ask to be a part of the physician recruitment, and I made the point that if a doctor comes to this town, it doesn't matter who shows them around, they have to see both clinics. They have to be aware there's 2 different clinics in this town.
On the other hand, if they've been told ahead of time that they're going to work in the other clinic, as has happened.
Well
they're
then, yes, and I think that would be something that Ken or George or myself would make very clear. You have a choice here. It's your choice which one you.
Dr. Chung had no choice. He was told.
He was told, yeah. Well, I couldn't tell you. I was not part of that, so,
No, I know. He admits he was told.
yeah.
Seems to be a lot of manipulation.
It's very
Yes.
hard to get your head wrapped around everything, because there's a lot of different interpretations of the same story.
Well, it seems to, that, from my understanding, it seems like they were streamed to the one clinic. They were introduced to the one clinic. This is a clinic where you can work in High Prairie, etc. Once they're signed on, then they bring them over and show them the other clinic.
Yes, we can't help what's going on behind the scenes.
And this is all Alberta Health.
Yes.
Services.
We have to use,
Alberta Health
yeah,
Well, that's right, and then
services.
there's Alberta Health and Alberta Health Services, and this is still.
And we have to use their recruiter.
Okay.
Well, from what you're saying and what was presented to us by Dr. Worry, there's
Bit of a disconnect.
some pretty big discrepancies on what you're saying to what he was saying
I-
and how this
I
thing
think
was
he
going
could
to
sell you
work
a used car.
and stuff, so it's like, I understand politics and stuff, I don't know if maybe he's giving us the whole picture.
He did provide us a report. Does anybody have that? Were you guys given that?
No.
Oh, look at you.
That's the
That might be
TELUS
something
report.
that we should leave with, because that was what we were provided. Do you
Oh,
guys
sure.
see any value,
Go ahead.
sorry, we're just in joining, tomorrow with Dr. Worry? So who do we have, Dr. Worry and who else is here?
Dr.
Oh,
Isaac?
Dr. Worry and another fellow.
Dr. Iva, he's our medical director from Edmonton.
Oh, good.
They're both gonna be here
Good to meet 'em.
tomorrow. Would it be maybe a better conversation that you guys were here to be
I
part of?
won't be here.
I don't
I'll
think
be
there's any
working.
point in us being in the same room with Dr. Roy.
No?
He's given up on us. And so we've given up on him. It's become personal.
Do you feel that this is a personal attack on both of you as the?
I think it's
we'd like
evolved.
to get rid of
I
us.
think it's evolved into that, yeah.
And why chase away doctors who have been willing to stay here and have worked here, and, I mean, how long are we gonna be here for? You know, we're pretty old, well, you are.
Well, and I think again, that's
You
how
know, they
it was.
could be gracious and let us stay in that building for whatever, 5 years, until we meet our demise, I guess.
It was presented as well as a solution to the upcoming concern that you'd want to retire, and maybe you'd already expressed, Pam, that I wasn't sure, like, I kinda got the impression that they had spoke with you and maybe that there wasn't too many more years that you wanted to be.
I don't
Well,
think
I'm
we've said
pretty
that.
old, but I've never said that.
No. Was that you guys' impression, that it was to deal with the fact that we have few doctors and the few that are here may not be wanting to stay very long?
Well, no, actually, Dr. Worry did mention this in one of his circulars. That's his reading things, that's not our reading things. He asked me when I would retire, and I said I had no plans to retire. I like working.
And we're happy that you do.
Well, but if he gets his way, I might be forced out of this community. And at 72, I don't want to be packing up and moving somewhere else.
So if, hypothetically, if they go with this model and they deny you access into that building to be part of that hospital, what's your recourse? Do you have to build your own building?
Buy or
Or can you
rent,
stay
or-
in the old hospital and work from there and?
No, it wouldn't be an old hospital, it would be demolished. No, we'd need to find clinic premises outside the hospital, which is a great disadvantage to our patients. Right now I see somebody goes to them an x-ray, I go and talk to them an x-ray. If we're practicing downtown and I send somebody for an x-ray, I'm not going to get the chance to go and see the person and talk about his x-ray.
Cause I mean, prior to the hospital that we have now, I mean, the clinic used to be the
Yeah.
building across the street for many, many years.
Yes.
And you would go to the x-rays and then come back with your x-rays and, you know, go through that whole process.
But X-rays are now electronic, so you can't bring X-rays.
Okay, well, it's been a long time since I've had an x-ray, obviously, then. But, I mean, we've had that system before.
Yeah.
you
But
know.
what we got out of the system when the new part of the hospital was on was a streamlining. And it was called one-stop shopping, that everything goes under the one roof.
Mhm.
It suited the community and it suited us.
I mean, it does make sense to have everything
Yeah.
under one roof, you know, for simplifying the process. I mean, you need blood, go to blood, you need x-rays, go to x-rays, you need physio, it's there, you know, it's all
Yeah.
there.
One story I was told, and I mean, I don't have enough history in the area to remember back or to know for sure who all to talk to about, was that the clinic that you guys are in was funded by the community. It was a fundraised endeavor to build it on to
The
the
clinic
hospital.
we're in now?
Yeah,
No, it was built by the government.
by the government. So I heard that it was built by
No,
and then taken over by the government
No.
afterwards.
no. It was all funded by the government. The then administrator built it and then went to the government and said, would you like to come and open this for us and bring the checkbook?
Well, I did hear they wrote a check right at the end, so that is true.
So I'd like to ask the intern fellow. You-
Chris?
It's okay.
Thank you. You've worked with Dr. Laughlin and Dr. Edwards in that system.
Mhm.
You're a new doctor that's coming up. The FC type system that's in Slave and the one that they're proposing here. What's your opinion?
So, as a new medical grad, one of the appealing factors about going into medical practice in a community such as this, rather than say a Medi center in the city or something else, is the fact you get to be your own boss and manage it as your own business to optimize the care and the speed as best you can. Because in situations where if you want to change one small aspect of the clinic and you have to essentially phone some up in Edmonton to get permission and then get them to email back to send something else to the director of the current facility, it's a very bureaucratic and time-wasting process. But when you're actually the proprietors of your own medical practice, you can make changes that will enhance your patient care without having to deal with all that bureaucratic mess, and you can do it now. The one aspect that the current clinic has, and most clinics around Alberta are now in, is the primary care networks. And that has actually been one of the biggest boons to family physicians around the province. And Dr. Laughlin and Dr. Edwards are currently in talks, I believe, with the Athabasca Primary Care Network to join it. And what it does is it offers you abilities to try and get some of the aspects that the FCC has as mental health nurses and things like that that are not in your community, and being able to send your patients to other places they can access faster. You don't need the FCC model to do that. I think an FCC is great in an urban center where you have people that just want their 9 to 5 and to get away. But when you have a lot invested in a small community and it's more personal, I think that it's probably not the best fit. I like the primary care model better, like the primary care network, personally.
Any further questions? Is there anything else that you'd like to add? Dr. Laughlin, anything?
No, we're just looking for fairness. And that's what we want you to do, support our plea for Prairie. We can't stop the other clinic being subsidised. I think it's dreadfully unfair and clumsy, but we can't stop it if that's what he chooses to do. But I can't see what reason he has for denying us access to clinic space, other than being vindictive.
Do you know if they're going to allow a clinic in the Grand Prairie Hospital?
I don't believe so.
So none of the new hospitals that, because again, this is sort of what we were told was that newer hospitals, they're sort of changing the model. They don't want any private enterprise, which is questionable still when we think about, as far as I can understand, the health, the kitchens are still going to be catered, right? So there's an opportunity for private enterprise. So it's not totally cut and dried. But is that true? Is that what you guys are hearing as well? Like, or are some of the new facilities, like, do we have a model to use as an example?
No, our situation has been unique in the province. We were the only in-hospital clinic since it was opened.
Mr. Warren, if I may, and Robin's statement there is I guarantee is correct, that they were probably the first. As far as new hospitals, I can't comment, but in small communities around Alberta, I've practiced in several, and even looking at like the Lethbridge Regional Hospital, places like Killam, Camrose, and Hanna, all places I've been to through my medical training, there are clinics based in the hospital, and this is actually a very good model. It's based on the Mayo Clinic in Rochester, Minnesota, which is known as probably the best medical care you can ask for in the world. And the whole point is to coming down to what Dr. Laughlin was saying, is that it's the one-stop shop, is you don't have to leave the building to get an x-ray, to see a physio, to see a mental health nurse, a dietitian, what have you. And this is actually why, if you look at Edmonton, you'll see their, I think it's $600 million Edmonton clinic was based around the very same model, is that they want people to basically take the elevator for everything they need in one single building. And the only difference is there it's for inpatients in the hospital, and outpatient medical clinics that are private contractors on their own.
You've had enough of us, have you?
I could sit here all night.
$29.95 for that comment. That's what my mother
Let
used
the
to tell
student
you.
do it, I'm free.
Well, thank you for inviting us.
Well, thank you for coming, and you've given us some things to discuss with Dr. Murray, you know, because we were told different things, and you're telling us different things, and it's the communication and the disconnect is somewhere, and I think as a community, I mean, you have your loyal patients that, you know, have stood by you and continue to, and the other clinic also had their patients. But I think by them basically saying no, we're going like this, it's really not giving the community the choice that they need or want, because obviously there's enough to sustain your clinic and the other one. So by taking that choice away from people, giving them access to your clinic or whoever they choose, the disconnect with what we're being told is not making sense to me.
Okay, thanks again.
Thank you very much.
Thank you very much.
Chris and
Yeah, just because it basically didn't happen. Be able to get a copy and I could. First Ave and 3801 51st Ave.
has to say, and then
This was the
This is Highway 2 here.
Here, you know, it's-
But I would say it's 51st Avenue.
Because that's why they have the lettering up the top. That's what I'm thinking.
Yeah.
I'm guessing.
Is there any further discussion from council regarding this issue? Thank you very much.
Thank you.
Thank you, everyone.
Thank you.
Letting me get my 2 cents.
Appreciate it.
Appreciate it.
Thank you. You're
How
welcome.
long are you here, Chris, until?
I have another 2 weeks. You've had me for 2 months, and then first week of January, you guys get another one. They keep sending them, so.
They keep sending them.
Good.
All right, take care.
Thanks.
Bring the spouse back.
I will try.
She can be the one they send.
I'll let her know.
Okay.
Nothing further?
It's,
Councilor?
what's the envelope?
I guess my,
Thanks, guys.
thanks. I guess my question is, they've presented to us, we have a meeting with Worry. I mean, is there much as a council that we can do?
Yeah.
Well,
Like, where do we go from here?
Well, we, on our previous agenda, had a letter that we supported that the Laughlin's clinic could be in the hospital,
Right,
but it could be interpreted as a community health and wellness center clinic instead of a declaration that primary care network clinic. So we could actually send a letter stating that the High Prairie Medical Clinic space should be allocated within the new health complex for the High Prairie Medical Clinic to operate it as it wish. Right?
Yeah, that's your option.
Or we go back to the same model that we run,
Which is what it is. That's the primary
right,
care.
and not 2 spaces, just space for the medical clinic that you're, but I mean, I'm extremely confused.
Well,
Because
I
I kinda
can-
thought it wasn't a fee-for-service clinic, and I didn't think it was a, business, work is for profit, but ultimately I didn't think it was a for-profit facility. It was owned by Alberta Health, and these doctors were employees of Alberta Health. It was sort of more or less
well, that's
how
what I
was-
understood, cause he
Well,
said
that's my
they come,
understanding as well.
they have no overhead.
So therefore, they wouldn't be competition to these people because they're just employees basically of the hospital, right?
Or
And
Alberta
it's
Health
certainly being,
Services.
it's certainly being presented more like it's a direct competition, and we're allowing one clinic in a
Every
hospital.
physician is a direct employee of Alberta Health. Every physician. It's just that if you operate out of the High Prairie Medical Clinic, you pay a 30% overhead to have everything looked after for you. You just come in, see the patient, you leave. You're done. If you go to this other one, it's the same system, but instead of paying the High Prairie Medical Clinic owned by 2 private individuals, you pay the government 10 to 15% of your overhead.
Cause see,
But
what
the
I gathered,
employees though are Dr. Laughlin's and Dr. Edwards' employees, whereas in the clinic, the people taking the information and the telephone would be the employees of the hospital or Alberta Health. They
Oh,
would-
you mean reception? Exactly.
So-
So it's
so
being
again, that
subsidized
overhead
by
is-
provincial tax dollars instead of by the physician paying directly. It's an added fee to the taxpayer.
Which means that the physician has to see more patients to make sure that he pays for that overhead.
You mean in this model?
Yeah.
Or what, the other flip side is that this model, say, is operating at an optimum, right? Say it is 30%, I'm not saying it is, but let's say it's 30%,
For sure.
right? And then it goes to the other side, and let's say it's 15. Well, that extra 15% per year now has to be subsidized by the provincial tax coffers, right? It's not only are we now paying a physician in High Prairie $500,000 to $1 million a year to be here, right? Alberta Health is, but now instead of 200, let's say it's $1 million for easy numbers. Instead of 300,000 going in for overhead, it's 150. Who's paying up that extra? And but the cost is the same, so it's another 150,000 a year per physician to the Alberta taxpayer.
see, I'm kind of like you, I'm confused, cause what I gathered from Worry was that means that they would be basically salaried employees.
Which was the retention and attraction, right?
Yes, cause they didn't have the big overhead, they would just be an
Yeah.
employee of the.
Yeah, that was the presentation
Quality of
and
life and all those things.
exactly the limited on-call, right?
Yes.
Emergency. But unless what frustrated me with that statement, if you have 4 physicians, doesn't matter which system, you still have 7 days to cover.
still have so many patients
Unless you
to
have
see.
more physicians, you've got the same frickin' problem. Doesn't matter which model we run with. I don't care if you sign on only to do 1 day a week. If I've only got 4 physicians, does that mean 3 days a week there's nobody working ER?
True, and we had that problem I think it was last week.
When Mr. Ministry's mom died,
Yeah.
and he had to
we
go
had that
back, and
problem last week.
Shepherd was denied and sent to Wabasca.
They had to, I know people who went to the
Or
hospital
informed.
in the morning, cause the kids were sick with the flu and whatever. They waited until 7 or 8 o'clock that night for a doctor, cause we didn't have one.
Well, I always wondered, and even when we were talking to Dr. Worry, so it'll be interesting to have a conversation now, tomorrow, how we were gonna service as many patients as we've been servicing and the expectation of our area to service it. Because if you're only gonna have X amount of doctors and you're limiting or you're trying to sort of detract them from wanting to take on more patients by changing the pay system, right? Then the discouragement, right, from taking on more than 30 patients a day. And these people, these doctors are regularly taking on maybe 50 patients a day. What are we gonna do with the backlog? Like who's gonna be, or is that gonna be handled by, like my understanding is supposed to be handled by, we never talked about nurse practitionership, we talked about
It's basically a triage
Like
system,
the
which is
triage
what
system
Laughlin
is
said too.
what he
Yeah.
said.
It's supposed to be done. Rod Sherman said that you need the family care physician to be the quarterback and to direct everything, and that's the primary care network. Whereas in the community health and wellness center, it's you meet the nurse practitioner first, and then you streamline from there to whatever path. It's triage.
Any further discussion?
I don't know if an hour tomorrow is gonna be enough with Dr. Worry before from 5 to 6 for the council meeting. Like, I mean, this has brought up so many.
well, I think we can only do so much, but we do need to have a better understanding of both systems, right?
Right.
Which is all we're gonna be able to do is ask him questions and he's gonna have his side, which we've heard a lot of already, but at least we've
You know,
heard
it's
the other
gonna
side,
be
which isn't that
their-
they're all retiring, you know, like that was
It's
what-
gonna be their word against his when we ask him, say, well, how come you said that, Shed couldn't come? I didn't say that. Well, that's what we told.
No, he was here for 3 days, then he was told he couldn't practice anymore.
For
He
whatever
was
reason.
invited to go to Wabasca.
For whatever reason.
Yeah, that's what I wanna know is
Kinda
why.
like why-
When we're
why is
short
that?
physicians, why are
I
you
mean,
taking
why
one
would you
out?
turn away a doctor who wants to come here?
Pull that crap.
You know, why?
Well, it's to fail the system.
It's, yeah.
That's the implication. I don't know what it is, but the implication is, see, your model's failing.
Well, it's good that we got an opportunity to listen to what they have to say prior to talking to them, so we're better prepared to have that conversation.
True. And I mean, nothing against those 2 doctors with the clinic. I mean, I felt much more better taken care of in the other clinic, but I think the people in town should have a choice. You know, if they wanna continue to see Dr. Laughlin and Dr. Edwards, well, then they should have that choice.
There's an amazing amount of people too that they're going through their clinic, so.
There
Dr.
is,
Laughlin and Dr. Edwards will not be short of patients. If you are an older patient and you have been with them for 25, 30 years, even 20 years, you will continue to go, whether you go uptown or not. You're gonna go to those doctors.
Yes.
The people that are going to go to the community health and wellness patients are the younger people who don't care about the doctor. They want in, they want that medicine or whatever it is, and they're out again. There's 2 distinct patient groups here. They have their loyal people. And that's who they're thinking of when they say, well, it's easier for them to go to the x-ray or whatever. But no, they're not gonna lose. They'll have patients till they wanna retire.
Oh, definitely.
So,
I'm the
so
I'm the total opposite of you, cause I've gone to the other clinic. You go in, you're allowed to ask one question, you're out the door.
this
Doctor-
community health and wellness?
With the other clinic that was in the hospital, Dr. DeToy's clinic.
Associate clinic.
Oh,
Dr.
yeah,
Stewart
that
was-
was
At least
when
when
you went up.
at least when I went to see Dr. Laughlin or Dr. Edwards, I could sit there and I could discuss.
Talk
You're
about
not-
your arm, your leg, your headache, your whatever.
See, and my personal experience with Dr. Toy's clinic was he would spend the time talking to me saying, well, what's the problem? Why is this so high? Why is, what's going on?
So really the only question that we really have is, there's enough space in there for 2 clinics. Why can't you make it work so that it is fair? And that's what he asked. We want in and we want it to be fair.
And
So
that's not
the
an
question.
unreasonable request.
How do you make it fair?
Except that the question could be asked, does this create, by having two different models of healthcare, does it create a two-tier system?
It's not the 2-tier, I think it'd be the competition of resources. Cause now, are we gonna have, like, that was my question, are you gonna have a stream of physiotherapists, OT, and everybody that only see the community health and wellness people? And then you're gonna have now a duplication over on the other side? Cause currently we have everything he's telling us and promising us for community health and wellness. They're all there. They're already existing. So you're not giving us anything new. What you're doing is you're triaging through a nurse practitioner. That method is new and different, which is really what the FCC was about.
Right.
Yeah.
And then the nurse, also you don't request your physician. You go in, you see if you need a physician, you see the next one that's available.
And that's a question that we should bring up because of that. I had a constituent phone me, and the 2 questions they had were, are the people, if you have the 2 clinics, the community or the Prairie Medical Clinic, if you're a patient there, will you be put to the bottom of the list to see a physiotherapist? And I was assured, no. Those physiotherapists are open to all clinics and the hospital, therefore there will be no prioritization of patients. No prioritization.
Okay, but if they operate in the same system as the community health and wellness and they only need to see 20 a day or whatever X amount a day, again, what happens now to that backlog? Currently, we have 2
So that's
physiotherapists that see anybody and
That's
everybody.
not a prioritization. That's
Wow.
overbooking.
Or a limited access, right? Which is,
Could be limited to both clinics.
could be, or maybe there's just no access for the other side yet.
No, that is not what.
Well, we'll ask it.
All right, you can ask, and should be the answer because I asked it and it was answered. There would be no prioritization of patients.
There's a lot of questions for tomorrow. Cause are the physiotherapists going to operate on, do they have their option 2 now? Can they operate under a private or is it?
So, but I don't want to, from what I hear, because I give you the information,
Yeah.
and then you came back and you said, no, I don't believe you. That's what I heard you say, that you don't believe me, that
No,
there
what I'm
is
saying-
not going to be a prioritization, and you're giving me reasons why you don't think there will be.
Well, I would have an issue or a concern,
Okay.
is that if it is the community health and wellness system, that there's gonna be an X limited number of seen per day. Now, why would I see 31 patients if I'm paid for 30?
Okay,
Same
but
as
if he
an
gives
office.
you an answer,
Yeah.
is it, what I'm
It-
thinking
we
is,
have-
am I gonna hear an argument here if he says,
No,
the
you
answer
can-
is this, are you going to come back and
I'll
say, I
take
don't
that,
believe
it'll
you?
be on recording and it'll
Yes.
be taped and.
Lindsay,
Yep.
we're going to have an
Okay.
argument with everything, you know.
That's
No,
a
that's not true, he's,
And you gotta, if you don't get,
That's right.
what's pissing me off is if we don't pull the information out of them, they don't give it to us. That's the problem. Everybody's got their agenda. So rather than just put the information out there and let people talk, right? Let us make an informed decision. It's no. It's the way he presented everything in Edmonton. And even if you had questions, oh no, that's not what we're doing. Okay, now it'll be on recording, we'll have a public audience, we'll see if we get the same answers. Let's see what happens.
Well, we'll see, but we really didn't get a whole big chance to stand there. He basically thrust this upon us, saying, here you go, this is what we're doing, and we're like, okay, what are we looking at? And he's
You need to
telling us,
support us and see the minister and.
he tells us that this
And ask
is,
for 4.4 million.
you know,
Yeah.
he gives us the stuff and he says,
But it was
this
based
is
on
what
a
we're.
report, based on discussions with MLA, it wasn't because we decided that this is what we wanted in the community, this was based on
Yes.
Alberta Health Services, talking with local physicians already, because they had already been talking to Detroit's clinic, right, and they've already researched and made decisions on the area based on the reporting that was done. They'd already had lots of meetings with the MLA, so I mean, it wasn't like it was just, oh, here you go, see what the minister, is interested in, or if you can convince the minister of this. It was, this process was well on its way.
The information that was provided to us is generic. It doesn't apply to either system. This is the issues that you're facing as a community.
Right.
Doesn't matter what system's in place.
And they deducted from that this their model.
Well, and we have one physician at the Toys Clinic that is interested in the new model. And we think that's the model of the future. This is what we want you to do. This is what will happen. We were presented that 12 physicians have left High Prairie. Great. What's the timeline on that?
5 years.
12 in the last 5. Does that include the husband and wife physicians that were coming here as a
Team,
surgeon?
and they returned away.
And
I
they were
don't know.
pulled away by Alberta Health Services. So how can you count 2 that we were
Well, I'm not
recruited?
sure if those were counted.
Well, see, this is the
So that's why
manipulation of
you-
information,
Yeah.
right? Like,
But in saying that,
Well, what about
I
Shepherd
don't
Shack?
mind
See, one of
having
those
two models of clinics in this town. To me, we have the need here, and that's why I would support the minister, to go into the minister and say, we need more money. I actually don't care how health is delivered in this community, as long as we get more services. We are the 4th highest in need. You guys have gotta do something. Now, whether that means 2 clinics, whether that means one super clinic, I don't care, just get more services into this town. And the surrounding regions want that too. So let's listen to what Dr. Worry has to say. Fairness to me is paramount. I want to know why, how could we be fairer? What is the calculation model that you're saying is not fair or can't be fair or whatever? So that's my only question is, I understand they operate for a business, and I do understand that Dr. Laughlin's business model is a for-profit for Dr. Laughlin and Dr. Edwards. And perhaps, which he didn't say, and I'm not saying it is, but maybe it is too much of a percentage off of the doctors that come into his clinic. Maybe he should cut back his percentage limit. But then again, it's a business model. How he runs his business is his own business. So, all we can do is try to get this fairness out. Can we make this more fair?
And keep as many doctors in the area as possible.
Exactly.
Because that's what this is gonna do, this is gonna push. We're
And
gonna
offering both systems
can end
will
up
do
with
that.
one clinic, which is only gonna have so many doctors. And I don't see that the model, and we'll ask Dr. Worry more about that tomorrow. I don't know how many doctors it's going to in the end attract, and if it really truly is that they only want to see 30 patients a day, they almost have to have double the amount of doctors than what we normally think is necessary in order to make that.
Or the triage needs to look at the ones
That's
that
true.
don't need to be there and say, go home, drink lots of fluids, take an aspirin, call a doctor in the morning.
Yeah, no, I'd like to see what he says
Or
about the numbers, because he knows the number
send
of
them to
patients that are coming through our area, right? So they know the numbers of patients that are coming through the area, so they must already have, and I don't think we were provided that information, right?
And the other question was answered, I'm sorry, but by the constituent was, is this going to be a family care clinic? And I did ask Dr. Iberg that, and he should have the differences between a community health and wellness clinic and a family care clinic. And he should be able to list those differences, because this is not a family care clinic that is coming to my Prairie. So although the model failed in Slave Lake, or needed a lot of work as a family care clinic, that is not the model that is coming. What are the differences between the 2 models?
Yes. One thing that I would like, I haven't heard a thing from you, man. What are you thinking, Trevor? Because you're just sitting there, your wheels are.
I'm thinking,
What do you got, Doctor?
I'm just thinking, yes, very much so.
Okay. Value. Has everybody had an opportunity to speak? Is there anything else that we need to talk about? Seeing none? This meeting adjourned.
What was in the envelope?